Every 3 infected patients, definitely one of them is sepsis. And once the patient have sepsis, they have 40% of mortality, which is 40% of patients will have a chance to pass away. The problem now is that the focus of the disease itself was more to non-communicable disease, which is like cancer or heart disease. But however, the sepsis actually is number 3 killer in Malaysia. This one of my experience is that I deal with 70 plus gentlemen who come from a nursing home, presented with his left diabetic foot. The diabetic foot is getting worse, and in fact the whole limb is infected, and he entered sepsis stage, which he also comatose. We immediately started the antibiotics and also rescheduled him for a right lower limb amputations. However, because of the delay presented in the emergency department, the patient succumbed to death. The main challenges of diagnosing the sepsis is because of the symptom is very weak and it can be subtle, and also because of the public awareness is very minimal. There's no tool for us to rapidly detect sepsis beside our suspicious and also the sign and symptom, which is I have mentioned just now, which is weak. So I think this is where we need to put some effort on it. SepsisDot is a rapid diagnostic test kit to rapidly diagnose sepsis within 10 minutes. So how it works is that it looks like a glucometer, and you can diagnose the sepsis with 1 drop of blood from the end of the fingertips, and you can know whether you are having sepsis now or not, and should you come to hospital or not. Conventionally, we diagnose sepsis in the hospital because we need to run a lot of blood tests, which is take few hours to few days to confirm whether this is sepsis or not. However, with the SepsisDot, you can bring back home with 10 minutes with 1 drop blood. You can really know that patient need to come to hospital for further investigation on sepsis. SepsisDot can bring even to a disaster aftermath area or war zone aftermath area, which the medical resources is limited. It can use as a triage tool to triage the use of limited resources. When a child who are crying at night, parents is worrying whether the child need to bring to hospital. With SepsisDot at your home, with 1 drop of blood definitely can tell you whether you need to bring the child now to hospital or maybe later. It also can use in a nursing home to rapidly detect whether this elderly having sepsis or not, and to decide whether to bring the elderly to hospital. So SepsisDot definitely is a game changer, and it can rapidly help you to diagnose sepsis, and also will change the whole sepsis management ball game, and more patients will be safe because of this SepsisDot.